Big changes are coming to the UK's healthcare system. Prime Minister Keir Starmer has announced a radical decision to abolish NHS England.
So today I can announce we're going to cut bureaucracy across the state, focus government on the priorities of working people, shift money to the front line. So I'm bringing management of the NHS back into democratic control by abolishing the arm's-length body NHS England. That will put the NHS back at the heart of government where it belongs.
But what does this mean for everyday Britons? How will this affect access to healthcare? And what led to this moment in the first place? Welcome to Clock Africa, where we dive deep into global stories and historical events that shape our world. Before we get started, hit that subscribe button and turn on notifications so you never miss out on powerful stories like this one. Now let's get into it. To understand the gravity of this decision, let's take a step back and look at the history of the National Health Service, NHS. The NHS was established in 1948 after World War II as a bold and revolutionary idea. Free healthcare at the point of use, funded by taxpayers. Before the NHS, healthcare in Britain was a privilege rather than a right. If you couldn't afford a doctor, you didn't get treated. It was that simple and brutal. The man behind this vision was Aneurin Bevan, the Minister of Health at the time. He believed that no one should have to choose between their health and their financial stability. The creation of the NHS was one of the most significant social reforms in British history. It provided universal health care, dramatically reducing child mortality and increasing life expectancy. But how well has it worked, and why is it now on the chopping block? Fast forward to today, and the NHS is struggling. Long waiting times, overworked staff, underfunding, and aging infrastructure have made it difficult to maintain the quality of care that Britons expect. Let's look at some key problems. The NHS has some of the longest hospital wait times in Europe. A patient in the UK can wait months for a specialist appointment. With nearly 112,000 vacancies in the NHS, staff are stretched thin, leading to burnout and resignations. Despite being funded by taxpayers, budget cuts and mismanagement have left hospitals struggling to provide adequate care. Many Britons now find it incredibly difficult to book appointments with general practitioners, GPs, leading to overcrowded emergency rooms. So what's Keir Starmer's big plan? Why abolish NHS England instead of fixing it? NHS England, established in 2013, was meant to operate independently from the government while still being publicly funded. The idea was that politicians wouldn't interfere in how it was run. But critics argue that this system has added too much bureaucracy and slowed down decision-making. By bringing the NHS back under direct government control, Starmer's administration believes they can speed up decision-making and remove unnecessary layers of administration, redirect funds from bureaucracy to hire more doctors and nurses, reduce wait times and improve healthcare services overall. Sounds good in theory, right? But not everyone is convinced. Many experts warn that this move could backfire. Why? Because the NHS was originally made independent to protect it from political influence and constant government budget cuts. Critics argue that direct government control could mean more political interference in healthcare decisions. If funding remains the same, the problems won't be fixed. Decentralization was meant to improve efficiency, not create chaos. Public confidence is low. Many fear this is a step toward privatization, where free healthcare may no longer be guaranteed. And let's not forget, the NHS isn't just a service, it's a part of British identity. Many Britons take pride in having a healthcare system that doesn't discriminate based on income. The NHS has been celebrated in the Olympics, films, and national debates. It's a symbol of Britain's commitment to social welfare. If the NHS is dismantled or significantly altered, it could change the country's entire approach to public health care. Some fear that moving toward a more privatized system, like in the United States, could mean higher costs and unequal access to care. Now let's talk about what this means for you if you live in the UK. Potentially faster services, With fewer administrative bottlenecks, there could be quicker access to doctors and specialists. More healthcare staff. If the government uses funds efficiently, there may be more nurses and doctors on duty. Risk of increased costs. Some fear that if government control fails, a shift toward private healthcare could follow, meaning Britons may have to pay for services they once got for free. Impact on medical professionals. Doctors and nurses could face policy changes that affect their work-life balance and salaries. If we look at global healthcare systems, we see some interesting comparisons. Canada has a public healthcare system similar to the NHS, but it struggles with long wait times like the UK. Germany operates a hybrid model where healthcare is universal, but patients have some private insurance options. The US has a predominantly private system, which provides fast access to specialists, but at a high financial cost. Could the UK be moving toward a more mixed system, or will it remain free and government-controlled? The big question. Ultimately, this is a massive gamble. Will it fix the NHS or make it worse? So what do you think? Will scrapping NHS England save the UK's healthcare system or lead to an even bigger crisis? Let us know your thoughts in the comments. At Clock Africa, we bring you powerful stories from around the world, history, politics, and global affairs that matter. If you found this video insightful, hit that subscribe button and turn on notifications so you never miss out. Thank you for watching, and see you in the next video.